Maria Holder Diabetes Center.
Even without symptoms, uncontrolled blood pressure can damage your organs.
It's the first show in May, so you may listen to 15 diabetic-friendly minutes starting up right now on VOB 92.9 FM, all with the compliments of the Barbados Diabetes Foundation.
And if I were to listen, what may I hear today?
In today's show,
the common symptoms of diabetes would be
Nurse Tracy Bushel
I know Nurse Tracy
gives you the common symptoms to look out for if you might be getting diabetes.
Unfortunately, when you're living with diabetes, sometimes wounds behave a little bit naughty.
Dr. Diane Brathwaite on if you have a naughty diabetic wound. That's a wound that's being problematic. How do you deal with it? All of this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that is there for you in May and all throughout the year. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A happy May Saturday morning, VOBers! This may be Peter Boyce, or it may not be, but may I remind you that if you are diabetic or pre-diabetic, the Maria Holder Diabetes Center, located in Warren St. Michael, right behind Eunice Gibson Polyclinic, is your one-stop shop for any diabetic issue you may have. You might be listening to VOB and you might be wondering how much times I say May since this show start, or you might be wondering,
I've never been diagnosed with diabetes yet, so how would I know if I may have diabetes?
For the answer to that, we go to a woman we have not heard for a long time.
She scares like rice.
Diabetes specialist Nurse Tracy Bushel. So we asked Nurse Tracy, what are the common symptoms of diabetes? And she said,
the common symptoms of diabetes would be things like extreme tiredness, extreme thirst, passing lots of urine, which is sort of a bit of a vicious circle because you're thirsty because your sugars are high, and then you might be drinking drinks that contain a lot of sugar, which is pushing your sugars up higher, and then the way that the body gets rid of it is out through the urine to get rid of the excess sugar. So, thirst and passing lots of urine can be very lethargic. You might get blurred vision because of the high sugar levels, and all the little blood vessels as well. And some people don't get any symptoms at all. There's a lot of people walking around that have diabetes and are certainly not aware. But if you have a strong family history of diabetes, certainly over the age of around 40, we would always recommend you to be screened at least once a year, because obviously the earlier that it's picked up, the better it is, to get going with, the relevant lifestyle changes and any treatment that's required.
as Nurse Tracy said, the earlier it is picked up, the better it is for you. So if you are listening and you know you have not been checked for diabetes recently, call and make your appointment with the Maria Holder Diabetes Center. And while you are there, make sure you also show Dr. Diane Brathwaite, who is coming up next to discuss this very important topic. Make sure and listen.
Now, if you're wearing a dressing because you have a wound or an ulcer, first of all, if you have an injury or an ulcer and you have any complication related to diabetes or your blood sugar is not well controlled, please see a healthcare provider immediately. Do not delay. Do not try to self-cure for your wound. If you have a wound or anything that's sizable, and even if you don't have any complications, please see a healthcare provider. Unfortunately, when you're living with diabetes, sometimes wounds behave a little bit naughty. The risk of infection can be higher. The risk of not healing properly can be higher. And you want to make sure you take care of your feet. Go early, don't wait, don't self-care. I've come across some cases where some people stay at home and they're cleaning their feet. It may be with a concentrated betadine, a concentrated hydrogen peroxide, other concentrated chemicals, and they actually come back in with further injury to the skin, like burns, irritations, eczemas, because of these chemicals that they're using. So be smart and get the correct advice. If you have a dressing, make sure you keep your dressing dry. You're not meant to take wounds in bath water. Bath water is not clean and it's not sterile. Not completely. You do not want to put your wounds in bath water. If that means wiping off with a little flannel in a basin, you're not going to die. It is okay. It is okay. Trust me. Alright? Some people think that they have to shower every day. Showering every day, yeah, wonderful. But come on, if you have a wound on your foot, you really don't want that foot or that dressing to get wet. Make sure that it's secure. If you have a dressing that becomes loose, do not wrap it around all the way around 360 degrees with tape or anything else that's tight, because that can actually cut off the circulation and cause problems. And then finally, if you notice that you have a dressing but it's getting a little bit dirty, because naturally if you have a wound, food is going to kind of exude, contact your care provider. And if for any reason your dressing gets wet, you may need to take it off and cover it just with some plain gauze. Secure it gently with a light bandage, maybe a crepe bandage, and contact your care provider so that you can get guidance as to how to do it. If you're going to consider doing dressings at home, make sure you've had a discussion with your care provider so you know what dressing material you're using and how to do the dressings. I never let people do dressings at home if I've seen them, unless I have shown them how to do the dressing properly and safely, and they know what dressing material they're going to be using. Also, if you have a dressing, don't squeeze it into a tight enclosed shoe. Sometimes you may need to have a shoe that has an adjustable strap to accommodate the dressing, and that definitely won't be rubbing over the dressing, or you may need what we call a post-op shoe as well. Okay, and those can be accessed from a number of rehab centers, or your doctor can give you guidance as to where to get it, or we can give you guidance. We have a few, not many, but we can give you guidance, or any other organization involved with diabetes care can give you guidance. So please take care of yourself. We want everybody to keep those feet healthy, and remember that earlier you present with a problem, the less likely you are to get an infection. I can never stress enough, puncture wounds are a surgical emergency, and generally speaking, and almost every single time, you need to have the puncture tract examined. You may need to have it remove punctures, basically do the bad job of pushing foreign substances down inside the skin. And if that's not properly treated, it can set up an infection. I call it the inside out infection, where the inside gets infected and you only recognize it when it's seen on the surface of the skin. But the problem with that is that the infection on the inside is generally quite severe, or is much more severe than what you're seeing on the outside. You don't want to put yourself at risk of ending up in a surgical theater to have to remove a lot of dead tissue and infected tissue, or even putting yourself at risk of amputation. I hope these tips have been helpful. I want you to have a beautiful weekend. Have a little fun still. We're all human. But of course, just take good care of yourself. Please take good care of your feet. And we're here for you if you need any information and advice. So I'm signing out. But before I sign out, before I get licks, Alfonso, happy weekend. We haven't had a lot of chatting recently, but we're going to do a little session, maybe next time, and keep it lively and fun. And Alfonso, you might be a puppet, but make sure you take care of your feet too here, because I need you to be my partner in diabetes crying. Happy weekend. Bye-bye.
Then Alfonso here. Yeah, Dr. D just called me a puppet. She mistook me for Peter Boyce. And Dr. D, she live with me later. Cause she always at work. Sometimes work at too much stress can carry sugar levels too. Dr. D can tell you about that one next time. But right now it's time for the Saturday song of the day. And even though Dr. D called me a puppet, I will still be nice and dedicate this song to she. This is the music of Brian Bumblebee. smile, say, be nice. Compliments, the Maria Holder Diabetes Center and Republic Bank. Be nice, everybody.
Niceness is a thing essential for good living. Yes, it's a thing that we really need.
Maria Holder Diabetes Center.
Niceness, a value influencing the way we live. So let us heed this initiative. Let us be nice from the time you open your eyes each morning.
Let us be nice.
Let the ones you love know the way you're feeling.
Let us be nice.
When you're on the road, give each one a greeting. You will discover that can break down any barrier. Be nice, be nice, be nice, be nice. Listen one and all, let us heed this call. Be nice, be nice, be nice, be nice. Make this world a better place.
Unfortunately, when you're living with diabetes, sometimes we'll behave a little bit naughty.
Maria Holder Diabetes Center.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening.
Who should get the screening, boy?
Persons living with diabetes, persons who experience pain while they are resting, or a burning pain sensation in their legs or toes. If you have what is called bad circulation, if that sounds like you might need this vascular or ABI screening test. Let's hear what vascular spokesman Donald Clark had to say.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins has their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins, but varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on, there's no blood flow, or there's, I should say, reduced blood flow to the penis, of course, but in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
1 in 3 adults with diabetes also has high blood pressure. Don't ignore it.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100. Board members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
The Maria Holder Diabetes Center.